We will now move on with the steps for removal of the PPE, also referred to as doffing. It is highly recommended that for all levels of doffing, the observer shall be in one level lower than the one that they are assisting. 1. The trained observer will inspect PPE prior to doffing to identify visible contamination, cuts, or tears in the PPE before the doffing process starts. 2. The trained observer will supervise the doffing process to minimize potential contamination that could occur as each PPE is removed. 3. To assist with proper removal of PPE, the observer will read the doffing sequence to the healthcare worker in a step-by-step fashion during the doffing process. 4. If at any time during the doffing process the healthcare provider feels that their gloves have been compromised, he or she may disinfect their hands without being prompted to do so. This can be done by applying an alcohol-based hand gel into the gloves and allowing them to dry. The alcohol-based hand gel should be pumped onto the gloves by the observer or come from a free-flowing automated dispenser. You should not pull or push a dispensing lever since your gloves may be contaminated. We will now begin the doffing process. Step 1. First, you will disinfect the outer gloves on your hands with an alcohol-based hand sanitizer and allow it to dry. Remove the outer gloves by grasping the outside cuff of one outer gloved hand with the opposite outer gloved hand. Peel off the outer glove only. Hold removed outer glove in remaining outer gloved hand. Slide fingers of now inner gloved hand under remaining outer gloved hand and wrist. Peel outer glove off over first outer glove. The inner glove remains on unless contaminated. Discard in appropriate biohazard waste container. Step 2. The next PPE to be removed is the face shield. Handle by the headband in the back of your head since this should be the least contaminated. Pull the headband forward to remove the face shield. Discard in an appropriate biohazard waste container. Step 3. The next PPE to be removed is the fluid-resistant head and neck cover. Place your hand at the top of your head, grasping and pulling the head and neck cover back away from your head. Ensure that flaps of the head do not drag against your face and head while removing the head and neck cover. Following removal, immediately discard in an appropriate biohazard waste container. Step 4. The next PPE to be removed is the impervious gown. Loosen the ties that are around the waist area. This PPE should be removed by only touching the inside of the gown and then pulled away from the neck and shoulders. Then turn the gown inside out by slowly rolling the gown from clean to dirty. Gently fold and roll into a tight bundle and discard into an appropriate biohazard waste container. Step 5. The next PPE to be removed is the fluid-resistant foot and leg covers. Use both inner gloved hand. Slip second and third fingers inside of the foot and leg cover. Fold and roll the cover down towards the ankle and foot, never touching the outside of the foot and leg cover. Lift your foot up and slide your foot out, pulling the foot and leg cover away from your body. Repeat this step for the other leg and foot. Discard the PPE in an appropriate biohazard waste container. Step 6. Now remove your inner nitrile gloves. First, disinfect the inner glove with an alcohol-based hand sanitizer. Then, grasp the outside of the glove with the opposite gloved hand. Peel off and hold the removed glove in remaining gloved hand. Then, slide your fingers of ungloved hand under the remaining glove at wrist. Peel glove off over first glove. Discard the gloves in an appropriate biohazard waste container. Then perform hand hygiene with soap and water or an alcohol-based hand sanitizer. Step 7. The doffing process is almost complete. Now remove your goggles by handling only the straps of the goggle and pull the straps over your ears. Step 8. Without touching the respirator, slowly lift the bottom strap from around the neck up and over your head. Handling the N95 respirator by the straps, discard in an appropriate biohazard waste container. Step 9. Now wash your hands again and put on a clean pair of gloves. It is highly recommended that you wear deconnable shoes. Sitting in a chair, disinfect deconnable shoes using an EPA-approved disinfectant wipe and wipe all external surfaces of the deconnable shoes. The container with the impregnated wipes should be labeled EPA-approved on it. Now discard the disinfectant wipe in a biohazard waste container. Step 10. For the last step, remove your gloves and discard into an appropriate biohazard waste container. Then perform hand hygiene with soap and water or with an alcohol-based hand sanitizer. During this entire doffing process, the trained observer must observe for any breaks in protocols and contamination of the healthcare personnel, and report any break in procedure and record it in the patient encounter log. This is now the end of the doffing process for a Level 2 ensemble.